Hey guys, so we left off talking about the eye the other day. And one of the things, if you remember, that we talked about was how the eye is very much like a camera. Again, more of an old school kind of 35 millimeter camera, because what ends up happening is you have light which enters in through a system and is projected onto a sensitive surface, which is the film. Now, that's the case of the camera. And if you talk about the eye, one of the things that occurs is that light comes into the eye and is projected onto the retina, which is the sensitive surface on the back of the eye. So they operate in a very similar sort of fashion. Now, again, when you go and you take a look at some of these graphics, I'll show you one on a couple of slides. You can really get a feel for how the eye starts to work. There are multiple parts of the eye, and it all starts on that outer covering, the cornea, which we had talked about, which is that sensitive surface. Again, if you talk to anybody or if you have ever scratched your cornea, it is excruciatingly painful. It is one of those things that can just be a debilitating kind of pain. It fades. In most cases, it has no problem, and the eye will heal itself. Our bodies are really miraculous like that. It is enormously painful in that moment, and of course, the body is susceptible to infection if you were to scratch that cornea. The iris, if you are a blue-eyed or brown-eyed or green-eyed, hazel, whatever you might be, that is coming from your iris, your colored portion of the eye. It is a muscle. It is an enormously powerful muscle that is working constantly during the day to either let more or less light into the eye. The lens, similar again, as we said, to the lens on a camera, is going to take that information and project it onto the back of our eye, where we will find it on the rods and cones and the retina and all those other beautiful things that we'll get to in a minute. As we continue with the parts of the eye, we have our pupil. Now, the pupil, again, we talked about this with the change of size of the pupil, depending on how much light, with the light going on and off as you're looking in the mirror. We also talked about the psychological factors. Is somebody lying? When we get into motivation and emotion, we will really ask and answer the question of our eyes windows to the soul. Then again, on the back of the eye is our retina. This is our sensitive surface, like the film on the camera. We have millions of photoreceptors, things called rods and cones that are back there. But there are no rods and cones in one particular area that is on the back of our eye, and that is where the optic nerve exits the eye. These are the nerve fibers that are carrying those neural impulses from our eye, where we are gathering light, to the back of the eye, where we have our visual cortex. Now, that blind spot, which I mentioned a moment ago, we have no rods or cones where the optic nerve exits the eye. So because of that, we possess what is called a blind spot. Uh, Again, we have two eyes. They're constantly moving. We have a brain. When you add all of those things together, what it gives us is a blind spot that, in essence, we fill in. We fill in the gaps, but it's there all day long. And the last part is the fovea. The fovea is our central focal point. The majority of the cones, the particular photoreceptor that we talked about, are going to center in that region. And again, this little video clip that is right here is our buddy Bill Nye the Science Guy. If you watch him again, he will walk you through it. So there's a quick review of the parts of the eye. Now let's go on to what the photoreceptors actually mean. We have two types. We have rods. These are enormously sensitive to the darks, the blacks, the whites. These are what help us on our periphery. Again, your peripheral vision, not very detailed, not very vibrant in terms of colors. That's because the rods are predominantly at work. They are also what is at work in our dim levels of lighting. So if you walk into a dark room at night, you wait for a split second, your eyes will start to adjust. They will let more light in. The rods are powering up as your cones are powering down. Cones are our daylight vision. They respond best to the red wavelengths, those of longer wavelength. These are the things that shut off at night and allow our rods to get to work. And again, those little mnemonic devices that I gave you, if you think about the darks and the whites, think about A-Rod. He's not my favorite baseball player, but playing for the Yankees, he is going to be those darks and whites, just like the Yankee uniform. David Cone, any of you who are sports fans know that David Cone played on the Yankees at the end of his career. Me being a little biased, I think of him as a Met. The Met colors are blue and orange, bright colors. Those of you who know nothing about sports, and I'm just confusing you more, think of ice cream cones. Getting yourself a nice little set of rainbow sprinkles on there, bright colors. And also think of road cones, which are bright orange in color. Now I'm going to click on this link here, which is going to be a graphic for the National Eye Institute. I would suggest visiting this in your spare time. I know you guys have a lot of spare time there to visit. So if you take a look at the graphic, one of the things that will always come up, if they ask you to identify a portion of the eye, you always want to take a look at where the optic nerve is exiting the eye. That is going to be your, it's going to tip you off for where the back of the eye is with the optic nerve. And if you take a look there, you can see the iris exists on both the top and bottom because it is a circular muscle that is either expanding or contracting, allowing more or less of the pupil to be visual there. And you can also see the idea of those little tiny gray dots lining the back of the eye. Those are our photoreceptors. And notice how there are none where the optic nerve is exiting the eye. So that is why we have that blind spot once again. Now, one last time, now that we have a pretty good understanding of the eye and the mechanics of it, we'll talk for a second about color vision. And when you talk about normal color vision, quote unquote normal color vision, an individual can distinguish between almost 7 million different shades of colors. And that is mind-boggling when you take a step back and think about a number like that. But that reminds me of, once again, it reminds me a lot of if you go to a Home Depot or a Lowe's and you go into the paint section and you see all of those samples of colors and some of those different shades. It can drive you a little batty, but it shows you just how many different colors we are able to recognize. When we talk about color deficiency or color blindness, you're talking about a minute, roughly 2% of the population are color deficient. And what does it boil down to? It's not that color blind or color deficient people can't see color at all, but they see color and experience it very differently. And as it says here, it's usually the result of either the person is missing a set of photoreceptors or they are having a malfunction of a set of them. Now, we're going to talk in a second about the trichromatic theory of color vision, where we have these multiple different pairings. What this boils down to is an individual who's color deficient is usually what we call dichromatic instead of trichromatic. Now, if I click on this, I'm not going to go through the whole process with you, but it will bring up a color blindness test. And I want you to go through, it'll give you a series of these 12 tests here. What I want you to do is recognize now, if you are somebody who is color deficient, you are going to struggle to see some of these things. But please understand that the cards that they use to go through these, the colors hold true. When you project something like this onto a computer screen, remember, the quality and clarity of your color screen may have an effect of skewing the colors ever so slightly. And then if we play it on the projector in class, it could skew it even a little bit more. So just understand that as you go through this test. And I encourage you to do it on your own. It's kind of cool. You get a feel for what somebody who's color deficient might be battling. Now, how do we know somebody is color deficient? Well, there's a couple of theories on how this occurs. The first one, and let me go back for a second here. Apparently, I'm just learning how to use a computer, so bear with me. The first one is actually what is called the Young-Helmholtz trichromatic theory of color vision. Two researchers, Thomas Young and Hermann von Helmholtz, who were doing their work primarily in the 19th century. Young comes super early on. I'm talking turn of the century, 1800, 1801, 1802, right around there. And what he recognizes is that we possess three different sets of cones, color-based photoreceptors. And what ends up happening is we are a mixture, everything that we see, of these colors. And he focuses primarily on reds, blues, and greens. And that everything we see is either a red, a blue, a green, or mixtures of those. And these different sets of cones that are on the eye prefer different wavelengths. And this is where von Helmholtz comes in a few decades later and kind of builds on the work of Young. He says that things that we see on the redder end of the spectrum are wavelengths that are much longer, and those cones prefer the longer wavelengths. But as we work our way down and we get to more of the blues and the violets, those ends of the spectrum, they're the much shorter wavelengths, and they prefer those. Now, this did a great theory of explaining color vision. It was, excuse me, a great theory of explaining color vision. The catch is this. It doesn't do a complete job of explaining it. And that's where the work of a gentleman by the name of Ewald Hering comes in. Towards the tail end of the 19th century, he proposes something called the opponent process theory. And Ewald Hering's theory does a really good job of explaining a phenomenon called afterimages, which we'll get into in a second. Now, he said the work of Young and von Helmholtz was good. Don't discount it. But what ends up happening is he says it's also about opposition. And we have pairings of photoreceptors, what he called red-greens, yellows-blues, and black-whites. And what ends up happening is this is much more based on neurons and the neural basis of color vision. When incoming light information is being relayed to the brain, we end up having the effect of fatiguing one of these colors, and then if we kind of take a pause and step back, we end up seeing the other color. So in other words, if you're seeing one of them because it's being powered on, the reds are being powered on, the greens are off. So what Hering realized, and this is kind of what led him into his work in the first place, you couldn't see things that were reddish green in color or bluish yellow in color. And Hering wanted to know why. And this is where Hering's theory comes in and really does a good job of kind of complementing what Young and von Helmholtz had done, because this does a really solid job of explaining color vision to us. Now, it also does a really good job of explaining what are called afterimages. Now, afterimages, and you may have seen these, afterimages occur when, as I said a second ago, your neural response to a particular color starts to fatigue. It tires out. And when that happens, if you look away for a minute and stare at a white surface, you are actually going to see the opposing retinal process. So if you take a look at this graphic below right here, if you were to stare at this graphic for like 30 or so seconds, then take a moment to blink and look away at a white surface, blank white piece of paper. If you focus on that white surface and blink for a second, you will actually see what's called a negative after image. You will see the opposing color here. So in other words, if you see the green in this, the opposition to the green for us is going to be the red. And the opposition to the black for us is going to be the white. So you kind of get a feel, and with the yellow is going to be a blue. So you kind of get a feel for obviously what you'll see on a white surface here. So give it a try for a second. And here are a few more graphics that you can try. Remember, you want to stare at a focal point, so stare right at the center of this figure, away at a white image, and see what you can see. And you can pause it on the screen. I'll go on. Try this one. You want to stare vertically at these 4 dots. Look away and see what you can see. Now, what are the results of color vision here? Color vision is a 2-part process, is what it boils down to. We see reds, we see greens, we see blues, because we have these cones on our retina, and they respond to different stimuli. They are excited, if you will, by different stimuli, or they're inhibited. Following is the nervous system processes this, and this is where the opponent process theory proposed by Ewald Hering does a really good job of complementing the Young and von Helmholtz trichromatic theory. Remember, nothing is going to be absolute in its explanation here oftentimes. It is going to be something where we get a complementary response. And that's going to wrap it on vision for us.